My crew and I have been asked to respond to a motor vehicle accident. As we come upon the scene and during our initial windshield assessment, we see one overturned vehicle and a single body laying approximately 60 feet away. There are no bystanders in the area. We are assessing the weather and the environment. It's sunny. We can see everything. There is no precipitation. We would be concerned about the mechanism of injury for this patient being significant brain injury, spinal injuries, and trauma due to the fact of being thrown from the vehicle. We would don the correct PPE. We would determine if we needed any other additional resources at this time. We do not need those additional resources. As we come up to the patient, the general impression is it is a 48-year-old white male who is laying on their back. They appear to be unconscious. No overt signs of bleeding and or significant fractures. As we come up to the patient, I would instruct one of my team members to maintain cervical alignment during the initial assessment until we could further stabilize the cervical injuries that might be present. We would determine first the level of consciousness of this patient. If they do not respond to us walking up, we would see if they would respond to verbal stimuli. If they do not respond to verbal stimuli, we would then check for pain. If they do not respond to pain, then we would then determine the patient is unconscious. Their level of consciousness also may change at any time during the initial assessment. While my partner is maintaining cervical alignment, I will perform a modified jaw thrust maneuver to be able to open the airway to check for any obstructions such as vomitus, teeth, blood. If I see any of those things, I would clear the airway. If the patient requires it, I would provide the correct size oral airway support to maintain the patient's airway. We would then obtain the bag mask valve to insert into the airway that we have placed and bag the patient at a rate of 10 to 20 breaths per minute in order to maintain adequate oxygenation of the patient. Once the airway was stabilized, I would listen, and feel for adequacy of chest rise, see if it is symmetrical, see if the patient is breathing spontaneously. I would also note any breath odors and or the quality of the respirations. Are they deep? Are they shallow? Are they rapid? I would then go on to check the circulation of the patient. I would check for a carotid pulse and a radial pulse. Once again, I would be noting the rate, rhythm, and quality. I would also check for capillary refill. Anytime I touch the patient, I am assessing their skin. I will be assessing their skin for things such as their temperature. Are they too hot? Are they too cold? Are they diaphoretic? Are they too dry? I would also be assessing their skin visually, looking for signs and symptoms such as cyanosis for hypoxia. I'd be looking for bruising. I would be looking for bleeding, lacerations, punctures. What I would do after checking the circulation is part of that assessment is checking for blood in areas where I cannot see. So I would feel along and check to see if there is any bleeding on either side of the patient, on their extremities and on both arms. At this time, I would then get a full set of vitals, the respirations, the pulse, the blood pressure. If we have the opportunity at this time, would be to get a C collar on this patient so that that neck is fully stabilized.